This training module provides information on the appropriate personal protective equipment, or PPE, the proper handling of blood, potentially infectious agents, and other hazardous materials. This training complies with federal requirements from organizations such as the Centers for Disease Control and Prevention, the National Institutes of Health, and the Occupational Safety and Health Administration. University policy requires the use of PPE at all times when handling biohazards. All personnel working with biohazards are required to be trained in wearing the appropriate closed-toed shoes, eye and face protection, gloves, lab coats or gowns, and respiratory protection if applicable. Closed-toed shoes are required in all areas where hazardous materials are present. Sandals and flip-flops are prohibited. Eye and face protection, including safety glasses, goggles, and face shields, protect the eyes and face against splashes from hazardous materials. Always wear safety glasses or goggles to protect against splashes. Face shields supplement safety glasses or goggles and provide an additional level of eye protection when working with hazardous materials. When wearing a face shield, goggles or safety glasses must also be worn. Safety glasses or goggles must be worn over prescription eyeglasses. Do not substitute personal prescription eyeglasses for laboratory eye protection. Always wear gloves appropriate for the work performed. Gloves create a barrier between you and hazardous materials. When wearing gloves, it is important to remember all used gloves must be disposed of as biohazardous waste. Always remove gloves and wash hands thoroughly before leaving work areas. Disposable gloves are designed for single use only. Do not wash or reuse disposable gloves. Gloves must fit adequately and must be appropriate for the task. Gloves must be replaced if they are damaged, punctured, or contaminated. Gloves may cause an allergic reaction. Symptoms range from mild to severe and may include itchy skin, hives, and even anaphylaxis, a potentially life-threatening condition. In case of an allergic reaction, seek medical attention immediately. To prevent latex allergy, use gloves made from an alternative material such as nitrile. If you have any other allergy concerns, consult your principal investigator. Lab coats or gowns are required when working with biohazards. Always cover exposed skin and personal clothing to avoid potential contamination. Lab coats or gowns must be washed or replaced when they become contaminated. Contact EHS to learn more about safely laundering contaminated lab coats and gowns. Respiratory protection may be required in some laboratories or areas depending on the organisms to which you may be exposed. The principal investigator or their designee will inform the staff if they are required to wear respirators. Both medical evaluation and proper fit testing are required to wear a respirator. Respirators are provided at no cost to the worker. Contact Environmental Health and Safety to learn more about the EHS Respiratory Protection Program. Other recommendations for working safely in the lab include wearing minimal jewelry on hands and nails to ensure the integrity of gloves. Dangling jewelry may become entangled in PPE or lab equipment and cause injury. Natural fingernails must not extend more than 1/4 inch beyond the fingertip. Artificial nails are not recommended when working with biohazards. Securely fasten any long hair when working with hazardous materials. Remove PPE before leaving the work area. Do not wear PPE in non-laboratory public spaces, such as corridors, elevators, restrooms, and break areas. Contact Environmental Health and Safety for additional guidance on personal protective equipment. To receive credit for this training, complete the test with a score of at least 80%. For questions or assistance, contact EHS.